New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back. We're talking about living better, longer, avoiding complications. Just this week, by the way, in most of the medical journals and in the periodicals, Wall Street Journal included, were articles about Joan Rivers and her tragic death. They report, and this is an article from Associated Press that said the comedian, who was 81, died September 4th. She went into cardiac arrest during a routine medical procedure to check out her voice changes. They said that it was classified as a therapeutic complication, meaning death resulted from this is what the Associated Press and the Medical Examiner said, a predictable complication of surgery. She died from low blood oxygen during a medical procedure. And again, they called this death and the low blood oxygen a predictable complication of surgery. So why do we talk so much about trying to avoid surgery? Well, one is predictable complications. With surgery, patients put to sleep and people have cutting of various types going on. Things happen. And it doesn't mean that anyone necessarily did anything wrong, but it means that patients take additional risks. And with, for example, radiosurgery, you can generally avoid those surgical risks. You can avoid the complications of being in the hospital, of being in a bed, blood clots in the bed, of superbacteria, superinfections. We know that 99,000 Americans die of infections they get in the hospital from staff not washing their hands. We know that 750,000 Americans get infections. They get infections from staff not washing hands in the hospital. So it's a risky place. And if you can decrease your risks in your life, you're probably ahead, way ahead. And if you get better results, like we've talked about, for example, with prostate cancer or other cancers and tumors, many brain tumors we treat, like acoustic neuromas, meningiomas, pituitary tumors, non-invasively. No cutting, no bleeding, no anesthesia, no hospital stay. We're an outpatient facility treating most cancers and benign brain tumors and other diseases. Just give us a call. By the way, we're taking calls. We're live at the WOR studios. We want to wake Noah up so he doesn't go to sleep. We're at 1-800-321-0710. 1-800-321-0710. I want to talk about another man who came in this week. He's a very famous artist. He's published several books and has expositions out there. He has a Gleason 6, PSA 7 prostate cancer. He's 70 years old. He's fully functional, and he wants to stay fully functional. So what's the data? Let's just talk a minute about the data. A lot of people talk about, proton beam. I heard about proton beam, so what's the data for proton beam? Well, actually, in our booklet, we have the data, us versus proton beam, 5-year data, cancer-free, Gleason 6. Here's the data, 76% with proton beam. We're at 87%, 14% higher. And for the people with the riskiest cancer, Gleason 8, 9, 10, proton beam is 48%. Chance of being cancer-free at 5 years. We're at 70%, which is 46% higher. So if you had prostate cancer, would you want, for example, with the Gleason 8, 9, 10, to have a 48% success rate with proton beam? Or to be 46% better with us? So it's obvious, why do men come for prostate cancer to Radiosurgery New York? Well, we've been at it for 25 years. We have data. We publish our data. We present our data. We have a full facility, from the linear accelerator to the CAT scan to physics to even the operating room if you choose to have prostate brachytherapy, where we place seeds directly into the prostate to place the seeds where the cancer is to give the highest dose. So, again, we have a booklet available to you. We have a new DVD which just came out Friday, and we're happy to mail it to you if you call us during the work week, Monday through Friday. And you also learn about our technology and our philosophy, why we do what we do, and how we do what we do. On the other end of the spectrum, we had a woman come in this week, 61 years old, came in with her daughter. She's married, she has 3 children. She has a gastric cancer. She's been treated. She was actually diagnosed first in July 2012. She presented with nausea and vomiting. She had a gastric primary, so it's in the stomach. And at that time, it was involving other sites, including lymph nodes and peritoneal surface. Peritoneal surface is the abdominal cavity. So it was already leaving the stomach, the exact stomach, and going into the abdomen. The stomach is inside the abdomen. And she started on chemo in August 2012, and pretty much she's been on chemo ever since. She's had progressive symptoms. She's had MRIs showing nodules there. She's been on chemo for 2 years. She's lost 30 pounds just in the last 6 months, from May until October 2014. Her weight dropped from 132 down to 102. She's really weak. She's trying to work 35 hours a week. She can barely keep her head up. I saw her. She has trouble eating. She said she couldn't eat even a quarter of a grilled cheese sandwich. Her stomach is filled with cancer. She wants to get help. We spoke to her about trying to open up her stomach with just a few focused beam treatments, and even talked about biopsy-directed chemo, which is a new way of getting chemo. So we biopsy the cancer, we send it to a laboratory, and have the cells, your cancer cells, tested in a laboratory to find custom-made chemo for you. So she has stage 4 cancer. She wants to get better. We're going to try to help her get better. It's been 2 years of chemo, which really has not helped her elsewhere. And in the good news department, a man with a great sense of humor, I think a little Irish humor. He's about 75. He had a big cancer on his scalp, which was treated with surgery. He had Mohs and surgery and radiation and all kinds of things elsewhere, standard radiation. The cancer came back. Now he's got a big hole in his scalp where they did that Mohs surgery. And he's fair-complected, you might guess. He's got 2 more cancers. He heard about us and non-invasive treatment. He's fed up with surgery, fed up with cutting, fed up with usual radiation. We treated the 2 new cancers, squamous cancers, with focused beam treatment. He came in this week. I saw him in the waiting room. I said, "You're looking great." He said, "Is that it? I'll see you in 3 months." I said, "No, I'm going to sit down with you in the exam room and talk to you and examine you." He has a great sense of humor. I sat with him. I examined him. I talked with him. He is very happy about our treatment. He avoided all the complications of cutting and surgery and Mohs and standard radiation. He had focused beam with us. He's intact. He's in remission. He's doing great. He's happy about it. Has a girlfriend or 2. And we'll see him back in 3 months. He's in remission. First follow-up visit. Another good news department, a man who presented, 61-year-old black man. He's lost 100 pounds in the last year. He's had chemotherapy at one of the big hospitals in Manhattan for lung cancer. He has neuropathy, which means he has numbness in his hands and feet. He lost that 100 pounds, wasn't feeling well. He was staged up and had a cancer in the chest. We treated him, even though all the other treatment didn't seem to help him very much. He had standard radiation and chemo, lost all that weight, had all the side effects. We treated him without any side effects. He just came back for his follow-up visit. We restaged him. His cancer's gone. He's in remission. It's a good news department. That was just 5 treatments. So elsewhere he had weeks and weeks of daily treatment, months and months of chemo, lost 100 pounds. With us, 5 treatments, feeling well, stable, no side effects, in remission, proven by scan, and we'll see him back. And we'll report to you as the years go on what happens to this gentleman. And we have another woman who I've been treating for the last 4 years with lung cancer. Why did she come to us? because we treated her husband 10 years ago, and he was cancer-free from his lung cancer. They're both smokers. She continues to smoke. She's actually a construction worker, crane operator. So if you know those big cranes in Manhattan, she's one of those crane operators. She's a fully functional woman, has lung cancer. We've treated her several times over the last 4 years to different spots. So some people say, if you have metastatic cancer, you need chemo. Well, there's lots of people who don't want to have chemo. They just refuse chemo. They don't like chemo, or they had chemo. It doesn't work. It doesn't help them. Isn't tolerated. This woman knows what we do from her husband more than 10 years ago. She's had treatment. She's been in remission. She's doing great. Everything's under control. She continues to work and lead the life that she wishes to lead. So it's good news for her. And similarly, lots of good news tonight. I want to talk about a woman, an Indian American. She came from India. She was diagnosed with esophageal cancer. Elsewhere, she was treated at a famous cancer place. She was treated with chemo, radiation, and then surgery for esophageal cancer. The esophagus is a tube, by the way, between your mouth and your stomach. So food goes down the esophagus. Well, she had blockage of her esophagus. She had trouble eating. She had chemo, radiation, and surgery elsewhere. And right after that, she was worked up. And, in fact, the cancer came back right where they cut on her. Where they cut on her esophagus, the cancer came back. When they cut on the side of her chest, the cancer came back. She was pretty upset. Her husband and son were pretty upset. They came to us. We talked about all the options. She was thinking about chemo elsewhere. She had had chemo before. Chemo didn't stop this spread of the cancer. She decided to go ahead, give radiosurgery a chance. We treated these two areas, by the esophagus, by the chest wall, both follow-up, cancer-free. Now, believe it or not, she comes back again this week, and another area where the surgeon had cut. So he cut on the side of her chest, he cut the esophagus, and he cut open her sternum. Now, where he cut the sternum, there's cancer. So it seems like everywhere the surgeon touched, there's cancer spread. I gave her all the choices. She knows about surgery, she knows about chemo, she knows about standard radiation, she knows about us. She's been through it all. Now, one treatment caused her to go in remission in two spots, the esophagus and by the chest wall. And guess what she chose for the mass by the sternum, where the surgeon cut her sternum open to remove the esophagus? Yeah, you got it. She's going to proceed with radiosurgery. We're mapping her out. She'll get started this week. And we wish her well. We wish her continued success. Right now we're 2 for 2. We want to be 3 for 3. And hopefully this is the end of her cancer and she'll live a long and healthy life. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center, a private cancer treatment center in New York City. During the week, someone called after the show and said, well, what are you selling on the show? I guess he wants us to sell vitamins or herbs or bottles of this. No. We're not selling anything on this show. We're just talking about patients, how we treat patients, how you might learn from those patients so you don't stumble over the same issues. We're talking about medical articles, journal articles, scientific data, data with references. So you can look it up if you want to go to the Journal of Clinical Oncology or the Journal of Nuclear Medicine. You can easily go to the library and find the articles I'm talking about, and you can confirm what I'm talking about and the data. So we believe you deserve that. We believe that chance, as my father would say, chance favors the prepared mind. And we think that we can often offer people new options that they didn't know existed before. We also have hyperthermia treatment. Hyperthermia is a way of heating particular cancers. It's been known since ancient times that if you use heat, heat interferes with cancer growth. And in fact, there's something called heat shock protein, where the shock of the heat produces proteins that helps kill the cancer. So hyperthermia is used combined with usually other treatments like radiation, and we have one of the few hyperthermia facilities in America. So we were the first in America with body radiosurgery, first in New York with brain radiosurgery, and I'm happy to spend time with you to tell you why our treatment might be useful for you, might not.